People lose their teeth for a multitude of reasons. You could crack a tooth, you could get a large cavity on the tooth, you could be born missing a tooth. For whatever reason, most of the time it's very important to replace the teeth because once the tooth is missing, everything else will shift around it. So let's say, for instance, this tooth is gone. You think, that's in the back. Nobody's gonna see it, not a big deal. What'll happen over time though is this tooth will start to drift forward at a strange angle. The tooth below will drift up, and over time it'll throw your bite off to where you'll have areas where food's getting stuck. You might be chewing on your gum tissue. It just becomes much more annoying. Your bite may not be as even on one side, and it puts extra strain on the teeth around. So instead of distributing the force evenly, now you've got less surface area, but the same amount of bite force. When replacing teeth, there's four main options. Do nothing, which we've just discussed is not ideal. Do some form of a removable partial denture, something that clips in and out of the teeth. This serves as a placeholder. It's usually not ideal for eating with, and it's annoying because you could lose it. You have to take it out at night to sleep. There's downsides. Cost-wise, it is the least costly option when replacing missing teeth. The two that I would consider permanent replacement options are either an implant. So this patient had had a root canal. The root canal failed, tried to retreat it, not savable. So we extracted the tooth, bone grafted the area, and then went back in and placed an implant. And now we're ready to place a crown on that implant. That whole process took about 6 months, so not long enough to have significant shifting in her teeth. So we look at from the time the tooth came out to the time we're putting something back in, less than a year. You won't have major change in that time frame for most people. So nice permanent option with the implant. It's fixed in place. You brush it like normal, you floss it like normal. You can't get a cavity on it, but you can still lose the tooth to gum disease. So it's always important to keep the area clean. The other option is what's called a bridge. So if a tooth is missing, what we do is we go in and we shave down the tooth behind, we shave down the tooth in front, prepare them for a crown, and then we create something like this that looks, when it's in place, like 3 individual teeth, but in reality, they're all 3 connected. Now it's cemented in place permanently. It would not be able to come in and out like it can on this model. So it still functions like a permanent replacement. The downside is you still have natural teeth here that are all 3 connected. So if down the road you wind up getting a cavity here or here, the whole bridge is affected. Or if something breaks, the whole bridge is affected. And also cleaning becomes more complicated because you can't simply floss between these two. You have to thread something under or use a water pick. But that's kind of the importance of replacing missing teeth and different options to do it.